Gururaja, sir, can you please explain Panchavalkala Lepa, a bit of your Dravana precious knowledge on Panchavalkala and why you are using it, which company, etc. Please, sir.
Panchavalkala, the name itself suggests they are all the five barks from the peculiar five group of drugs like Udumbara, Ashwatha, Plaksha, Parisha, and these things. And they're all potent Kashayarasa Dravyas, and they have a special ability to stop the oozing. So whenever there is some oozing is there, then in that area, if you apply this Panchavalkala Kvata or Panchavalkala powder or Panchavalkala Lepa in the form of the Lepa, or it may be even ointment, is applied, then it is going to reduce the oozing in from that area, and thereby when there is any wound, if oozing stops or reduces, it starts healing. Until unless if there is a oozing, it won't heal. So that's the reason we use particularly for external application Panchavalkala Lepa, and Univa Medica comes with the Panchavalkala Lepa in the form of ointment. So that I have used in this case, and that will be giving you sufficient smoothening effect as well as reduces the oozing, and also it's a very good wound healer. Panchavalkala, because of its Kashaya Rasa and Tikta Rasa, this is going to help in bringing the anatomical discontinuation which was there happened in the case of Vrana, and definitely that will be helpful tissue building up. And of course, we know that Kashaya Rasa is a pradhana in Panchamahabhuta concept. If you take it in that sense, there is a Prithvi also very dominantly present in the origin of is very much important in the tissue building, particularly in case of ulcers. So with all these concepts, we can use it, and evidently the result is seen, and which suggests the thing what our acharyas have said regarding the Panchavalkala and its utility. It suits it.
Probably this cream can be used especially for people with say, diabetes or bleeding tendency. So it is very natural while cutting nails, etc. If there is a bleed, it can be the ready-made ointment which can be used as a styptic to reduce the bleeding tendency. So,
definitely, to reduce the bleeding tendency, this can be used, but as you suggested that while nail cutter and doing all those things, if there is any little bit of bleeding occurs, that will automatically stops by natural process of agglutinating fibrinogen activity, and bleeding process stops naturally. The clotting occurs. But those who have a tendency to bleed more, and those places which are under excessive pressure, like in deep vein thrombosis or DVT or venous insufficiency or atherosclerotic type of things, there the pressure is there, we are unable to move the blood in a right direction, then there is a chances of continuous oozing out, or even diseases like skin conditions like weeping eczema, where there is a wet eczema which is can be correlated with the Vicharchika of Ayurveda, where there is a continuous oozing. In such type of conditions, definitely the Panchavalkala will help, and it may be any wound. It may be static dermatitis leading to a venous ulcer or a diabetic foot ulcer. It may be so. In all those conditions, this can be used.
thank you, there, sir. And coming to the Panchavalkala.
Bed sores is another condition, so where this can be effectively used. Panchavalkala ointment can be used. Bed sores and Panchavalkala Kashaya Dhara in infected wounds, Dushtavrana, is really helpful. I have personally used that. Either Kashaya Dhara or Kashaya Siddha Kshira. So Kshira Dhara prepared with Panchavalkala. Nalpamaradi also works in a similar way. Shatadauta Gruta ointment is another one which helps in these conditions.
People who are bedridden for longer time, Panchavalkala churna can be at least made and used as a powder on their back, so that
absolutely it can be used as a sprinkle also, like churna can be sprinkled. So ointments can be applied. So definitely, of course, with some training, not to be in a particular position, to keep on swapping the positions of the patient. I think Panchavalkala and Nalpamaradi are always the best choices in this condition.
And in a wound, when we are doing Kashaya Dhara, for example, ideally, how many minutes it's continued?
Yeah, so if it is moreover Sthanika Dhara, like venous ulcers and other things occurring in the lower limbs, so I even recommend the foot dip. So like Avagaha, so Pada Avagaha, or dipping the foot into the warm kashaya, and care should be taken that it should be wiped off later ointment. So what I practice is first a kashaya dhara and then application of the ointment on a dry surface, so that will be adding to the effect of the healing of these wounds. Dhara can be done roughly around 20 minutes to 30 minutes. It can be done continuously. no issues at all. Even the dip can be given for around 20 minutes. So even it can be given twice a day if it is possible, if they can do it at home. So it is an easy remedy, and just while watching TV or doing something, anyhow they will be sitting for some free minutes they can spare. So prepare the kashaya, dip. So when patient is preparing the medicine all by themselves, that will also add to the healing. So the observance is there, the confidence will grow. So once the wound starts healing, they will start continuously practicing that. So ideally 20 minutes to 30 minutes, 35 minutes should be the ideal time. It can be extended also. So if we are doing the Sarvanga Dhara, so we can continue it. So lesions on limbs, so like both limbs. So we can take 15 minutes each for each limb doing the Dhara, or simultaneously if it is done. So by 2 masseurs on either side, so that can be continued for 25 minutes to 30 minutes can be done.